Hi, my name is John Ellion. I'm the founder, president, and CEO of Chartwise Medical Systems.
Hi, I'm Mary Cooper, the Executive Vice President, and we'd like to tell you about Chartwise and our product, Chartwise CDI. We're a software company that is focused only on clinical documentation improvement.
There is probably not another company that has as many people as we do focused on this one thing. Our focus has enabled us to create a complete software solution for the market.
Improving clinical documentation has become very important for hospitals, and it's not just about the revenue. It's about the quality, having a complete and accurate picture of every patient admission.
We've spent a lot of time thinking about this from the perspective of each person involved in improving clinical documentation, making sure the software is tailored to each of their needs.
For the documentation specialist, for example, we have tools that cover his or her entire workflow, from viewing the cases as she comes to work in the morning, all the way through to the query responses that she gets from the doctors, along with reports to show the work she's done.
For documentation managers, we have tracking tools and a robust set of reports that are real-time when you want them. You don't have to wait for information to be compiled at the end of the month.
The tools allow a manager to look at their overall program, to drill down to the work of each individual documentation specialist, and even look at how the doctors are responding to queries.
Speaking of queries, we have a very complete set built into our software that can be printed or sent to a doctor electronically. They conform to the AHIMA guidelines and help ensure that they are consistent. We can also add to our query library. If there are certain queries a hospital wants added to the system, Chartwise can support them.
For the CFO, Chartwise CDI has some great reports that show the financial impact of their program through the Case Mix Index reports. They can see resource utilization metrics such as length of stay, and if they're in a hospital system, they can see these reports for one hospital or their entire organization.
The Chief Medical Officer is responsible for the activities of the physicians, and we have specific reports that can provide that information. To ease the burden on the doctors, we have queries that are easy to answer and that are based on sound clinical data.
Today's hospital IT departments have a full plate of new healthcare reform initiatives. Chartwise CDI makes their job easy. It's a web-based system, so it requires no software to be installed or updated. We can have hospitals up and running within a matter of hours, all from a very secure data center.
In fact, we take data security very seriously. I get awfully nervous when I see people walking around the hospital with laptops that contain patient data. The data we store is secure from the moment it's entered and cannot accidentally be left somewhere or fall into the wrong hands. We also make it very easy for the hospital to interface with us. Our electronic interfacing system is a veritable Rosetta Stone of the HL7 world, as it can translate a variety of different formats into the one used by our system.
Chartwise is a very comprehensive system behind the scenes, but what the user sees is a very simple interface. They see effective tools that allow them to do their jobs more efficiently.
One thing that makes Chartwise CDI most unique is the built-in expertise. We can take some lab values or medication information and suggest other areas for the documentation specialist to consider. This is also a great training tool for new staff, since the knowledge doesn't walk out the door with the training consultant.
One of our newest features is our review reference material. With just a click, the documentation specialist can view information from the coding clinics, DRG desk reference, and coding guidelines. We also have RAC audit alerts to help them find those RAC red flags. Since we save all the queries and documentation in PDF format, they're always available for your audits.
Chartwise CDI provides some great features to our users. It assists in gathering more accurate documentation. It has unparalleled reporting capabilities, and the data is secure. We call that clinical documentation intelligence.